Rajiv, welcome to the APDW in Calcutta. It's been a pleasure having you, and we all as hepatologists know that the Journal of Hepatology, which you leadered over the last 2 years, has gone up very well. So pleasure having you.
Thank you very much. It's a great pleasure always to come back to Calcutta.
Yeah.
And thank you for the support of the journal.
Yeah. Rajiv, there are a few issues which I felt we could discuss. One is, you know that in India, alcoholic liver disease is very, very common. And there have been no significant efforts in reducing the incidence of alcoholic liver disease. I believe the Lancet Commission recently discussed on alcoholic consumption or alcohol use disorders. What is your impression on that, and how can you bring it down as a policy?
So look, I think, reducing alcohol consumption requires an interaction between each and every strata of the society. It starts with the media in terms of creating awareness. There is a whole lot to be done in terms of health education in schools, in terms of the problems associated with alcohol abuse, and of course there's a lot of stuff to be done in relation to advertising about alcohol, particularly to children. And we have got to be really careful in thinking about the bravado that is associated with getting drunk, which happens everywhere. So getting drunk means it is something which is a great thing to do, and to make a fool of yourself is acceptable. And I think what we have been able to do in the UK, in a way, is to start to address some of those issues by graphically showing what is happening to these people. So I can tell you about a program that I did about nearly 10 years ago for Dispatches, which is a sort of a BBC 4 Horizon program, which was depicting the problems associated with drinking. And this program was called Drinking Yourself to Death. And since then, there has been a series of articles which has been presented by lay media. But of course, in addition to this, there's a lot to be done in terms of legislation, and legislation in relation to advertising, in relation to pricing. And this is a really interesting experiment that is going on in the UK, whereby Scotland has introduced minimum price for alcohol. This is only about 6 months to a year old, and it has already started to show differences in terms of hospitalizations due to severe acute alcoholic hepatitis. In England, we have not been able to adopt it, and we think that that is because of an interaction between the alcohol industry, which is very dominant, and its influence, so to say, on the government. So therefore, in order to override issues with respect to alcohol, all of us are partners: the people, the schools, the educational system, the media, the alcohol industry, and also the government. We as doctors probably play a little bit of a lesser role, but it is up to us to drive the agenda. And I know for a fact that in India, I've been here for a few days, and I've gone around seeing what people are doing in hospitals. And in liver wards, nearly 50 to 60% patients are alcoholic liver disease, which is a huge, huge, huge problem.
Yeah, I have a feeling that the main issue is the media is not covering it adequately. Doctors are extremely busy managing these patients, and if the media takes it up, maybe it would make a difference. Plus the pricing experiment that is being followed by Scotland, maybe it would give positive results. In India, there was prohibition in a state some time back, and still going on in a couple of them. But when you go there, you still find a lot of alcoholic liver patients.
Yes.
So prohibition probably doesn't work.
No.
It has to be something more general, being adopted all over the country if you have to increase the pricing. Second issue is these patients usually have a very high mortality.
Yes.
They are prone to have infections, and where there is very little therapy that you can offer to them. What is your opinion on liver transplant being done in these patients who don't improve, And how long would you try medical therapy before you subject them to liver transplant?
You see, I think this is really interesting, a very important question, very close to my heart in terms of deaths of patients with alcoholic liver disease that have got acute on chronic liver failure, which, as you know, is a new syndrome that can categorize patients at very high risk of death. And again, this is a very emotive issue because in India, with liver transplantation mainly being related to living donors, to have active alcoholics who are ongoing drinkers being transplanted need to be looked at really carefully to see as to what the rates of recidivism are. And I understand from having attended a conference not so long ago that a lot of the people that are donating organs to their spouses, which tend to be males, are their wives. So there is obviously an element of coercion, and there's a whole of ethical debate around it. Suffice it to say that notwithstanding the ethical debate around transplantation of an alcoholic hepatitic who is at greatest risk of death, there is a whole issue with respect to outcomes, which tend to be good in the most part, with a 1 year survival of 80% or more can be achieved. And that's where the dilemma really lies. That is, on the one hand, you can get a good outcome. On the second hand, the wife is being asked to donate more often than not because of, issues which are obviously relevant. And recidivism rates are not being reported from these large number of patients that are being transplanted. There's a very good natural experiment, of course, going on in the US at the moment, where we've seen, and we have some data we presented recently at ASLD, where we start to see in the US that there is a shift in the trends for transplantation, particularly amongst the ACLF patients, the acute and chronic liver failure patients, towards a large number of alcoholics being transplanted, which of course is taking away organs from those with fatty liver disease. So I think, in the context of this whole story, I think we need to look at it again in several different chunks. And I don't think the answer is easy. And the answer is not easy because liver transplantation has such good outcomes, even for these patients, certainly in the short term. Longer term, of course, we do not know so far.
But Rajiv, how long do you think we should wait before we subject them to a liver transplant with medical therapy? In India, corticosteroids are usually not very successful because these patients land up into infections. And the other regenerative therapies of the type of alcoholics that come to us with a Madri score of more than 75 or 90, possibly GCSF or regenerative therapies also are not very ideal.
Yeah.
So when do you think that these patients should be taken up?
So this is a billion-dollar question, what is the right timing for transplantation? And as you know, it has got to be not too early and not too late. So we think that using the CLIF consortium classification, if a patient has got ACLF grade 3 on day 5 to 7, identifies an individual that is at a high risk of death of over 80% over the next 3 months. So I think, we think that there is a lot of data to validate the use of the CLIF consortium grading system in the ACLF population. And I think that, we can say very, very clearly now that if day 5 to 7 from presentation, if they still have ACLF grade 3, you should proceed with thinking about liver transplantation if they're otherwise candidates. Please do not use steroids in these people because you'll kill them. Please do not use GCSF in these patients because you will kill them also. And there's a nice data presented from the German group which shows that it's got no effect and it may actually be harmful. So therefore GCSF is out, corticosteroids is out for these patients, and we're left with liver transplantation with all the emotive issues that we've talked about before.
One last issue which I think needs to be discussed is patients with NAFLD always ask how much of alcohol is permitted for them. Firstly, the cutoff for NAFLD, should it be 20 grams or 10 grams per day for women and men, or it should be 0? And if a NAFLD patient drinks alcohol, how much should we permit them to drink?
Again, I think this is a difficult question because we are in a non-evidence-based area. I can tell you my perspective. So 20% of India, I suspect, have got some degree of steatosis. Whether you call them NAFLD or not, I do not know. So if you're going to tell all these 20% population not to have a drink, I think it is making a statement which will not be followed. So I think, I would say that in those that have got risk of established fibrosis, whatever way you have diagnosis, stage 2 or stage 3 fibrosis or high FibroScan, they should be on zero alcohol. If you've got no evidence of fibrosis, some steatosis with otherwise good liver enzymes, I would suspect that that population should be allowed to drink within moderation of up to 14 units, but under supervision and regular check, but focusing upon the weight loss, the exercise, and other nutritional supplements. So therefore, the answer is not yes or no, and I think the answer needs to be determined for the individual. Harmful drinking is across the board, should not be allowed, but in those that have got fibrosis, there should be zero alcohol. In those that have got no fibrosis, you can probably allow them to drink within safe limits. But of course, I'm talking in a completely evidence-free area.
Because one paper in hepatology also mentioned that small drink is good for the liver, just as they say that it's good for the heart.
Well, I'm not so sure that's true. And I think, again, we can look at it in so many different ways about one drink, one red wine being good for you, but whether it's a drop, whether it's a small glass, it's a big glass, it's a bottle, who knows? So my mantra is very simple. That is, either you should be allowed to drink within safe limits and you accept the risks associated with that, because we know the risks. But on the background of NAFLD, if you are drinking safe limits, then you need to make sure that you know that you are at risk. But if you've got fibrotic liver disease, you need to go to zero alcohol.
Thank you very much,
Thank you.
Rajiv.
Pleasure.
It's been
Thank
a
you.
pleasure.
Thank you.
Great learning for, I'm sure, myself and for the audience.
Thank you so much.
Thank you.